Thank you. It's nice to be here. Today I'd like to talk about integrative medicine, health and wellness, which is what KIEU HOANG asked me to do because he's developing this wellness center. And at Emory University, we do a lot of research to promote health and wellness through botanicals, nutrition, exercise, in addition to conventional therapies like chemotherapy or radiation or surgery. So integrative medicine is physical activity, diet, botanicals, natural compounds, and mind-body approaches. Stress reduction is very important for healthy living. Stress reduction includes meditation, yoga, acupuncture, pain control, massage therapy, but our research mostly is on botanicals, including lycopene, genistein. Genistein is the main compound in soy. So I will be talking about our research projects which involve soy. At Emory University, we have a botanicals research group, and we study several compounds, including soy. We have to do everything with a great attention to analytical chemistry and biology and biochemistry. We have several projects. This is obviously nothing new. 3,000 years ago, Chinese emperor has been using botanicals for treatment of diseases. Soy has been around for thousands of years, and it has a lot of very important health properties. This molecule you see on the right side is called genistein, which is the main compound in soy. And it has similarities to estrogen, which is at the bottom, estradiol, but it's not an estrogen. It is very important because I see sometimes in the internet people refer to soy as estrogenic. It is not estrogenic. Billions of people consume soy every day, and it has not been shown to have any estrogenic effects. In addition to being an estrogen-like substance, soy has many other benefits on bone metabolism and inflammation. Inflammation is very important in cancer prevention. So anything that reduces inflammation will likely have cancer preventive properties. Many studies have shown that people who consume soy have lower risk of cancer, including prostate, breast, lung. We have done some studies with soy in prostate cancer. As you can see here, soy reduces the growth of prostate cancer cells. We also discovered that if you take soy in addition to chemotherapy, it increases the efficacy of chemotherapy. G is genistein, soy, D is chemotherapy. When you take G and D together, you can see that you can see more cancer cells. But it does not increase the toxicity on normal cells. This slide shows that normal bone marrow cells can be protected with soy. It does not increase the toxicity of chemo on bone marrow. And in animals, we can show that soy can reduce the size of prostate cancer tumors. The bone on the left side is destroyed by prostate cancer, but on the right side, animals that receive soy in their diet, the bone is not destroyed. We can also show genetic effects of soy. This slide shows that soy can increase the expression of some genes and decrease the expression of other genes. There are many genes that are increased or decreased by taking soy. And in this slide, we see that genes that are involved in cancer cell growth are decreased, and genes that are involved in cancer death are increased here. In cancer patients, if we give soy, you can decrease the growth of cancer cells. These are from patients with prostate cancer, so that we can stabilize the PSA levels in patients with prostate cancer. We can also increase the efficacy of radiation therapy. If we give soy products during radiation, radiation becomes more effective, and these are animal studies that show that. Again, soy can change the gene expression, downregulation and upregulation of cells in prostate cancer. Those genes that are involved in DNA damage that are upregulated with soy, including the BRCA1 gene, which is very important for breast cancer and prostate cancer. And genes that are involved in inflammation are decreased. So soy has anti-inflammatory effects because it decreases the genes that are involved in inflammation. There are many other health benefits. In addition to cancer, there are also decreased cardiovascular disease as a result of soy. In this study, researchers used soy plus calcium and vitamin D, and they found decreased cardiovascular disease risk. Can you move that? So in addition to that, soy can have helpful, beneficial effects in kidney disease and diabetes. It increases insulin sensitivity and decreases kidney damage. And it also decreases hypertension in animals that are hypertensive. There are mechanisms of soy that affect the uptake of sugar in cells that can explain why the effects on diabetes are seen. Genistein, which is a soy compound, decreases the diabetes in animals that are fed soy. There's also metabolic syndrome, which has diabetes, hypertension, and heart disease, which can also be improved by soy. In this study, people were given either soy or placebo. As you can see, people receiving soy, they had less metabolic syndrome compared to people who did not receive soy. In animals too, you can show the same thing. The more soy you give, the less diabetes you see in the animal model. In addition to that, there are beneficial effects on memory. You can see that in animals, there are proteins that are involved in Alzheimer's disease, and soy can decrease the Alzheimer's disease-related proteins. And this is how it does that. Soy can stabilize the tubules in the brain that can help with brain function. Soy has to have genistein in it to be able to do that effect. In clinical trials in women, postmenopausal women, there is increased cognitive function when women are given soy compared to placebo. And it shows that there is improved cognitive function. Another study, again, looked at the same thing, soy versus placebo in women, looking at cognitive function, improved brain activity, brain function was seen. So in summary, soy has a lot of effects. It prevents DNA damage, it prevents inflammation, it has genetic effects, and it enhances the efficacy of chemotherapy and radiation and decreases the side effects of chemotherapy and radiation. So, like Hippocrates said 2,000 years ago, let food be your medicine. We can do a lot of things with soy products to improve health. Thank you.